Okay, so in this video we are now discussing about the duodenum and associated structure. So, you can see the first part of duodenum over here, this is second part of duodenum, third part of duodenum and fourth part of duodenum. The first part of duodenum is actually lying within the lesser omentum and it is a part of intraperitoneal content of lesser omentum and greater omentum. So, naturally it produces a radiological shadow during the barium male which is very distinctly seen in any radiological view of barium male X-ray of the stomach or duodenum. And also you note that the first part of duodenum is the most common area for formation of duodenal ulcer. In the second part of the duodenum, why it is important to note, because the pancreatic duct, the bile duct all actually enter and drain into the second part of duodenum. That means, the bile from the liver, the pancreatic secretion from the pancreas enter into the intestine through the second part of duodenum. First of all, you look at the internal surface of the second part of duodenum, you can see a lot of circular folds. These circular folds are called plica circularis. So, plica circularis and presence of villi is very important characteristics of the small intestine. So, here you can see the gallbladder, this is the fundus of the gallbladder, this is the body, this part is the fundus, this is body and this is neck of the gallbladder, this is cystic duct. Cystic duct joining the common hepatic duct. How common hepatic duct is formed? The right and left hepatic duct form common hepatic. So, common hepatic and cystic bile duct is formed and this bile duct comes behind the head of the pancreas, this is the head of the pancreas, and then this bile duct pierces the second part of duodenum and joins with the main pancreatic duct, and it forms a small structure called hepatopancreatic ampulla, and this hepatopancreatic ampulla open into the second part of the duodenum. If you do the endoscopy through the stomach, it is actually 8 to 10 centimeter distal to pylorus. That means, when you reach pylorus, we already know that after 10 centimeter you can reach the opening of the hepatopancreatic ampulla. What is this opening called? This is a very important opening, and this opening is also used for introducing catheter into the biliary tract to explore the biliary tract if there is any stone is there or not. So, remember again that the main pancreatic duct and bile duct, they form hepatopancreatic ampulla and they open into the opening called major duodenal papilla into the second part of duodenum. So, what is the clinical utility of this part? You can explore gallbladder and biliary tree without any major difficulty to the patient by endoscopy. So, you put your endoscope through the stomach, through the duodenum, you reach major duodenal papilla, from there you introduce the catheter, you can explore the biliary tree, common bile duct and all the other biliary apparatus. You can also explore the pancreas, and this is a very important radiological procedure which is called ERCP, endoscopic retrograde cholangiopancreatography. You can also see accessory pancreatic duct, it is opening in another additional structure, it is only in few cases we can find it, and which is called minor duodenal papilla. Now, let us see the parts of the pancreas. This is the head of the pancreas which is lying within the C loop of the duodenum, this is neck of the pancreas, this is uncinate process, this is body of the pancreas, this is tail of the pancreas. We all know tail of the pancreas is very important, because here lies the endocrine part of pancreas, mainly the islets of Langerhans which produce insulin, glucagon mainly lies in the tail. So, from the splenic hilum you can see follow the splenic artery. So, remember that from the abdominal aorta at this level there lies a very important artery called celiac trunk, and this celiac trunk divided into 3 branches: the splenic artery, the hepatic artery, and the last one, which is not seen here, goes to the stomach, left gastric artery. So, celiac trunk main 3 branch: splenic artery, hepatic artery and left gastric artery. So, you can see the 3 vertical vascular structure: portal vein behind, bile duct in front, and hepatic artery in front and to the left, and this 3 structure lies in the right free margin of the lesser omentum and enter into porta hepatis. There is also important to note that what are the structures in relation to the different part of duodenum. So, in front of the first part of duodenum, it is related mostly to the gallbladder. In the second part, just in front lies the transverse colon, but behind, as you see, the second part of duodenum lies just in front of the right kidney. So, if you are seeking the subhepatic space, hepatorenal pouch of Morrison, it is very close to the posterior surface of the second part of duodenum. What about the third part of duodenum? You can see here abdominal aorta, inferior vena cava. So, abdominal aorta, inferior vena cava lies just behind the third part of duodenum, and from those you can see 2 important blood vessels which are coming in front of the third part. This is superior mesenteric artery and superior mesenteric vein. So, superior mesenteric artery and superior mesenteric vein is the main content of the mesentery and supplying the small intestine. They are actually going vertically in front of the third part of the duodenum.